mas malaki, magandang malaki. Well, good afternoon to everyone and welcome to Benguet State University. But before that, may I recognize the participants before I give my speech. Of course, we are happy to have with us the members of the Sangguniang Panglalawigan, board member Durnoan and board member Pio. So our faculty and students of Benguet State University and representatives from the DSWD card, they are around. Okay. Dinawan Center for Culture and the Arts, Notre Dame Hospital, UP Baguio, University of Baguio, local government unit representative, CCDC College representative, University of Cordilleras representative. Itong UC were way ahead, was able to patent the Cordillera University before CCDC moved. So, well, anyway, you can choose another name, Cordillera University or University of Benguet, University of Latrina. Mayroon pa, there are other available avenues. And then, the local government unit of Benguet, also the provincial government, aside from the two board members, other participants, the student body organization, of course, from various sectors that were not, if there are institutions that were not called, the religious sector, my representatives also, led by the pastor who gave us the prayer. The media sector, based on the media, and then the members of the Cordillera Research Regional Health Research and Development Consortium. Ano ba? In others that were not mentioned, welcome to Benguet State University. I was happy to learn that you are now discussing about the observance of suicide prevention, which is a rampant problem, not only here in the province of Benguet, although there are only few, but in other areas like Manila, a lot of instances there were those who commit suicides because of poverty, because of personal problems like illness, because of maybe some other family problems also. So if we will be able to at least overcome this in ourselves, internalize some of the good practices that we can adapt into, at least when we will be exposed to the same problem, we'll be able to prevent it. There are instances that people really become very depressed, especially if the problems are
sa mga bisita na galing sa iba't ibang ahensya, organisasyon, mga health sector, mga eskwelahan, at syempre mga estudyante at mga colleagues. No? Alam kong yung pagtitipon-tipon natin lahat ngayon ay nakakaisa tayo no, sa layunin. Ang layunin mas maintindihan ang issue ng o fenomeno ng suicide, magkaroon din no, ng usap-usapan kasi hindi na pala pwede. No? Naranasan na kasi natin na tumahimik sa issue, pero tuloy pa rin. No? Parang ito ay isang silent killer pala, no? Na dahil nga sa taboo associated with it, hindi natin pinag-uusapan, hindi minomonitor, mabibigla na lamang tayo, halimbawa yung represent po mamaya, no? Na napakalaki, napakataas pala no, ng mga figures mismo sa ating probinsya o baka mismo sa ating mga munisipyo at barangay. No? So sa pagtitipon-tipon natin ito, ay di magkaroon din tayo ng pagkaplano at syempre mga aksyon. In fact, napakaswerte po natin ngayon no? Kasi nandito yung policy makers natin mismo sa probinsya ng Benguet, no? Sina Sangguniang Panlalawigan, Jack Brunuan, at syempre si Sangguniang Panlalawigan, Dr. Pio, no, na sila po yung nasa health and agriculture sector. Napakalaking bagay po sa atin ito dahil ngayon lang talaga tayo nabigyan pansin, no? Sa maraming taon sinasabi ko kasi 2009 pa po ang proyektong ito ng Institute of Social Research and Development kasama yung ibang departamento, kasama yung ibang mga opisina sa Benguet State University at di syempre yung isang local NGO natin yung ResearchMate. Sa ngayon po, no, ibibigay ko po yung siguro konting overview. Tapos pagtalakay doon sa tema ng World Health Suicide Prevention Day theme, no, as set to us by the World Health Organization. But let me start first with a story. No? It's actually a sharing of what I have experienced. No? One time I was in a national conference that talks about health and well-being. In that national conference, I specifically participated in a workshop for indigenous people's communities, and in that workshop, we were asked to talk about the health and health insurance scenario in our communities. I was then representing the vegetable farming sector. Well, I was alone, no, in that conference, and I was conscious in articulating that aside from the regular morbidity and mortality statistics that the region has always been presenting, na meron pang kakaiba, a nuanced data that would tell us no, na hindi lang po respiratory tract infections ang ating problema, kundi ito na rin po no, yung suicide. Doon sa bahagi na workshop, umupo talaga ako to really talk about the data. Na sabi ko nga, at the regional level, hindi po nare-reflect na top 10 ang suicide. But back in history, I remember, no, si Teka, a colleague of mine, showed me data in the 1970s sa province of Benguet. That was health data, health provincial data in the 1970s, number 10 po ang suicide as the top morbidity and mortality. No? I also remember in one of our Cordillera Regional Health Research Development Consortium activities, we specifically invited a barangay health representative, a midwife in the barangay, para ipakita sa amin na pagka sa barangay level, number 6 o number 8 po ang suicide. Pero pagdating kasi sa regional, nalulusaw na po siya. But anyway, back to my story. E di pagkatapos po ng workshop, someone was assigned in the group to present during the plenary. Unfortunately, during the plenary, the issue was deleted. Again, it was silence. It was muted. The suicide data, the suicide story was muted. Well, I was sad, but that was not the first time I had that kind of experience. So, of course, we all know Dr. Charles Cheng has been monitoring and documenting this pesticide poisoning as well as suicide data in the mountain terrain areas, and that was a very seminal work kasi siya talaga yung unang nagdokumento. At pumapangalawa lang po tayo, no? And then sumunod na po yung iba. Anyway, yung kwento ko on the silencing of suicide, I also realized, no, na a major contributory factor to that could be in line with the WHO theme, which is stigma associated with suicide, at consider ito no, na barrier for suicide prevention. Let me go to the slides. Sige po, siguro a brief situationer, although it was already given to us no, by Paul, that more people in the world die from suicide than from war and murder combined. That nearly 1 million people worldwide die by suicide each year, and this corresponds to 1 death by suicide every 40 seconds. In the national data, the suicide rate is 19 per 100,000. In a local study site, baliktad pala, no? In the national data, sorry for that. In the national data, 3.8 per 100,000. Pero in one study site, ang lumalabas po na suicide rate is 19 per 100,000. Okay, let me now move on to yung theme. Stigma. What is stigma? I look at the dictionary. At ang lumalabas po na associated with stigma would be these words: shame, disgrace. Why the taboo about talking about suicide? Why even the health sector is silent about suicide? Yes. Sa website ng WHO, ito po yung lumabas no, na causes of the stigma. Simple lang po, the lack of knowledge, or in short, ignorance. Public awareness of the character and treatment of people with suicidal behavior and the available treatment resources to help. Many times there is lack or insufficient services for healthcare for this kind of problems. Yet, data show that suicide cases has not conducted health or social services for any help at all. Yet, suicide is preventable. This lack of access to appropriate care is one of the many factors that magnify stigma associated with suicidal ideation and behavior. Stigma that is deeply rooted. Back in our Kankanaay culture, for example, nugamit ko na tayo, di ba nga, nag-suicide, adang-adagos di mapanunod nga, ay napag-awasan, or depression. Katuan sa gamin na ibagang na depression, problema na, it's self-inflicted injury. Isunat aking basol, and that ends the discussions. But look, we have to go beyond the individual. What are the environmental conditions, the economic, socio-cultural conditions? And then, knowing or awareness is not enough. We also have negative attitudes, kaya stigma, no? Or prejudice, which is common in many communities, even healthcare professionals. The fact that every time we go to some healthcare at supposedly kasama sa advocacy, they ignore the data, they shut it out, no? So parang nakakalungkot, no? Parang feeling nga namin, taga-university kami, hindi naman kami taga ibang service sector, halimbawa. Okay. So stigma is also the underlying motive for discrimination which can affect people seeking for care. The fact that we know, for instance, we become aware of an individual having suicidal behavior, ang tendency natin, imbes na kausapin, kagaya nga ng sabi ni Presidente, no, communication is very important. Nadi-discriminate pa siya. So how can they seek help if we isolate them? No? Or halimbawa, a family knows na medyo depressive yung anak niya, imbes na seeking for the right healthcare, mas ina-isolate. So how can you be more healthy? So I think at this point in time, ito po yung challenge sa atin, no? To really become aware, to talk about it, kasi nga it's no longer, ano ba ito? Hindi na isolated po yung ating cases as can be shown by the studies, no? Mamaya po, yung isang local healthcare provider natin mismo sa Mountain Trail area, magpro-provide po siya ng kanyang experiences as a healthcare provider. Okay, so rather than avoid the issue, we might as well talk about it. So in this case, this forum is indeed a chance for us to talk about it and plan about it. So may I now recognize the participating organizations. No? This forum is being conducted by the ISRD under the Office of the Vice President for Research Extension, together with the Office of Student Services, Mountain Collegian, DevCom, Department of Development Communications, and Department of Development Consortium. So may mga consortium members po tayo ngayon. And then of course, by the ResearchMate, our local NGO. Yun lamang po, and thank you very much for listening.
So my task today is to present to you what we have done for this project that we have implemented here in Benguet State University. So we named the project Pansigdan. So as a background, last June 2009, this project started out as a response to the request of representatives from the women's organization in the project site for intervention activities because of the sudden and alarming increase in suicide cases, especially among teenagers, no, in the community, starting in the last half of 2008 and then until 2009. So halos every week may nagpapakamatay na teenager doon sa lugar. And so these representatives of the women's organization approached Ma'am Ruth and asked for help kung ano ba ang pwedeng mai-render ng BSU na intervention activities. And then about the same time, that the news caught the attention of the provincial government, and so the provincial local government unit set up this provincial pesticide task force to look into the matter. And one of the results of the discussion among the members of the task force, we were represented then by Ma'am Batani, was to come up with a study for BSU to come up with a research to look into the factors for this occurrence. So the next month, after the establishment of the task force, a memorandum of agreement was forged between BSU and the municipal LGU for the conduct of extension activities and also the research. So bali yung project namin ay twofold siya. So one part is the research part and the other part is the extension part. We deemed it very necessary to implement, aside from conducting the research and just going there and gathering data about suicide and then coming up with our analysis and conclusion, we thought that it was very important to also conduct support intervention activities because of the sensitivity of the matter. So Ma'am Ruth talked about a while ago about stigma, and therefore we were also very concerned that we might be bringing in stigma to the community and also to the families of the victims. So sinadya talaga namin na concurrent with the research is also the conduct of this support intervention in the form of psychoeducational activities. So when we were coming up with the project, pinag-isipan din namin kung anong ipapangalan natin dito sa project na ito. And so we were deliberating among some words, local words, until we decided to use the word Pansigdan. it comes from the word sigud, which is a Kankanai word, which means good. No? So, kaya sinabi natin dyan, promoting well-being in this agricultural community in Northern Luzon. So, when we chose the term, we actually we were hoping then, as we are hoping now, that our entering the community, kasi parang naging intrusive yung pagpasok namin, nangingialam kami sa isang sensitibong matter, no? Na pwede sigurong if the community has a choice, sila na lang ang re-resolve sana doon. Pero pumasok kami. So, we hope that our entering the community, yung pakikialam namin ay nagdulot ng maganda doon sa community mismo. Please pardon me if I always say the community or the project site. So I am inhibited from mentioning the name of the community in compliance with the request of the community members not to mention the name of their community. Of course, you can always speculate kung ano yung lugar na yon, pero hindi mo na natin siya babanggitin, lalo na doon dito sa forum na ito. Okay. So we are very thankful for our local partners in the study site. Napakalakas po ng involvement ng Women's Association, Women's Federation, and the local government unit. So this is the composition of our project team. It's a good team because it is actually multidisciplinary. So you can find the disciplines in the social sciences represented in the team as well as other disciplines. So let me present first the highlights of the research part, no, of our project. So just to add to the situationer that Ma'am Ruth presented a while ago, according to the WHO, suicide is the top 3 cause of death, especially among young adults. So although dinideliberate kung ano ba ang age range ng young adults, but generally if we look at literature, is between 15 years old to 24 years old. So kung titingnan natin yung age group na yan, suicide ang top 3 na cause of death among them. So this is still in 2000, but the trend continues until today. A nationwide survey, the young adults fertility and sexuality survey conducted in 2002. So we primarily rely on anecdotes and stories from the elders and the community members. Okay. So, if we look at the context, yung project site is one of the communities along the mountain frame, no? So, alam naman natin na yung lugar na yon, mga communities doon ay into commercial vegetable farming, no? So, they had a long history of vegetable gardening starting pre-war pa, naman, and then until now. So, the vegetable industry has been a lucrative industry, and we know that it is a source of wealth and profit for our farmers. And today, vegetable farmers are confronted with these problems, no? With these concerns. Bumababa yung market prices for their produce, nagkakaroon ng risk ng pagkalugi. They're now being confronted with degrading productivity of the land because of the effect, no, of their heavy dependence on pesticides and other chemicals. And they're also being confronted with this. Isa ito sa ating mga current issue ngayon that our farmers face, no? So, kung makikita natin, the farmers are contributory to the economy, not only of their community but also of the province, no? And we commend them for that. However, kung makikita natin, nahihirapan din sila doon sa pag-sustain, no, ng kanilang way of life and the way they produce for their families and for their subsistence. the farmers have to play the game. Napipilitan sila na to go with the flow, no? Yung problema ng liberalization halimbawa, wala silang magagawa, so they have to make adjustments, no? And the implication of that is the increasing dependency on chemicals. Alam naman nila na masama ang epekto sa environment, masama ang epekto sa health, pero para sa kanila wala silang magagawa, kundi ganun pa rin at ipagpatuloy kung ano yung dati na nilang ginagawa. And that is to focus, no, on acquisition of farm input. So ang nangyayari, nasa-sacrifice yung kanilang household needs, no, kasi inuuna nila yung pera nila, inuuna nila na pambili ng farm inputs kaysa sa pambili ng kanilang household needs, no? All in the desire to have a bigger volume of harvest and therefore to have not really higher profit, but just the profit that allows them to move on in their farming. Na-disregard din yung health nila, and when they were asked, bakit parang ini-ignore nyo na kahit na may effect doon sa health ninyo at sa environment, pinapatuloy nyo pa rin ang paggamit ng pesticides. So, that would be their response, no? Ganun talaga. Nagkakasakit talaga ang farmer, parte yan ng vegetable gardening. So, perhaps we can now have an idea of the dynamics of farmers' decision making, no? They sacrifice their health, they sacrifice their household needs para lang mapagpatuloy nila yung kanilang agricultural production. So, another result of responding to the issues, no, that they face is to intensify more labor. So they spend more time in the farm, and as a result, parent farmers no longer have time to attend to their children. Lumabas ito sa isang discussion namin with the parents, no? The parents admitted that they don't really help their children in their homework. They don't even have this ganun po yung konteksto ng community. So doon natin isi-situate yung problema ng suicide. So this is the data we got from the recollections of the elders in the community as well as from hospital records. Yung iba na po namin kay Dr. Lulis. So, yung earliest recollection was in 1961, kaya doon kami nag-umpisa. So, from 1961 to 2010, a total of 52 suicide cases were reported. And if we notice, 80% of that happened within the decade of 2000 until 2010. No? And 32 of this happened between 2008 to 2009. Okay, so ito yung naging alarming noong 2008-2009. Yung pong green na graph is along the mountain trail area. Tapos ito pong red ay doon sa aming study site. So halos, according to age group, again, majority of the suicide victims are young adults. So this follow the trend nationwide and internationally. So this therefore has an implication in terms of our response, no, to and our efforts to prevent suicide. Talagang ang majority group na talagang target dapat natin ay yung mga kabataan. Okay. So when we were doing our analysis in the group, we couldn't really pinpoint to just one or two concrete factor or cause. Kasi nga isa doon sa objective namin, ano ba ang dahilan kung bakit sila nagpapakamatay? Ngayon, hindi namin ma-establish na pag ito ay meron, magpapakamatay na yung tao. Yan, no? So, it was very hard to establish really what could be this particular factor that led these teenagers, these young people to commit suicide. So, we ended up gathering together all the factors that we can identify and then putting it into this model. So the team came up with this model of suicide in a cash crop economy. So yung cash crop economy, ito yung konteksto na tinignan natin kanina. So ano yung mga nandoon kaya na factors? Bakit nagkakaroon ng suicide no? Or why do people commit suicide in that particular context? So we borrowed from a model called the proceed model. Etong terms na ito, yung predisposing factor, reinforcing, and enabling factors. And then, we put in yung specific factors that we have identified from our research. Okay? So, kung titingnan natin yung mga factors na ito, ibig sabihin, none of these factors can stand alone. They have to be combined with other factors to be able to really push the person to commit suicide. Okay? So, unahin natin yung nandito, yung tinatawag na predisposing factors. So, the predisposing factors are factors that may be present in the person himself or herself. It can be present in the social-cultural environment of the person or even in the physical environment of the person, which can serve as motivation for that person to commit suicide. So, motivation pa muna tayo, no? Kumbaga, dahil sa mga factors na yan, nagkakaroon na itong tao ng pag-iisip na parang gusto ko mag-commit ng suicide. So, those are the things that we consider under predisposing factors. So, what are these? So, yung lack of social integration. Social integration is the degree to which a person is connected with his group and with his community, no? And we observe that because of preoccupation with farm work, time spent mostly in the farm, the people don't have enough time to spend with friends, spend with neighbors, spend with children, para magkaroon ng socialization at magkaroon ng outlet, no, to bring out their concerns or whatever things that they are going through. Another is this, no, yung lack of social integration, especially of children, with the lack of connection of children with their parents in the household. So, ito yung sinulat ng parents, no, doon sa discussion namin with them. So, they find it a problem itong lack of time for their children and lack of time for bonding. And they also admitted that they compensate that by giving their children more allowance. So, baga, dinadaan na lang nila sa pera na binibigay nila sa mga anak nila. Ito yung isang pinpoint nila as a serious problem, no? Kasi halos lahat ng mga kabataan na nag-commit suicide, they did that during or after a drinking spree with their friends. And of course, we know that alcohol alters consciousness, no? It disinhibits sound behavior. So, halimbawa, problemado na nga yung tao, nag-grieve siya doon sa namatay na kaibigan, o kaya may problema siya sa pamilya, o kaya nabasted siya, tapos nakainom pa siya. The way he reacts to those problems would be different from how a normal thinking person would react to the problem. Okay? And then of course, ito, yung accessibility of the chemicals, no, that allow them to commit suicide. So dahil nga isang farming community ito, very much available yung mga pesticides and other chemicals na yan na pwede nilang inumin, no, kung gusto nilang magpakamatay. And so if we look at the data from 1961 to 2010, only 5%, no, of the suicide cases was carried out through hanging. The rest, chemical ingestion siya. Okay? Tapos, yung 32 na nasa suicide cluster, ito, yung mga ginamit. So, 30 through chemical ingestion. Tapos yung pinaka-common, yung paraquat, ang kanyang active ingredient, which has no antidote. Perhaps Dr. Alones will shed more light on this for us later. Okay? So, etong lahat-lahat yung nilagay namin doon sa model na yan, which we saw as the factors for the problem of suicide. So, ito po yung aming, yun yung research part namin. So, for the extension part, bakit ganun? So, anyway, that's support intervention activities, no? Ito naman yung mga kinonduct namin. Let me just show them very quickly. So, we did sectoral capability building with parents, with teachers, and with barangay health workers. We also carried out psychoeducational activities for grief and acceptance para sa mga bereaved families, stress management and career guidance for high school students. We also participated in various advocacy and awareness campaigns, yung suicide prevention of activities starting in 2009, yung BSU on the air, we guested there. And we also invited Dr. Sudan and other staff from the Extension Office to help us dito sa teaching farmers on the effects of pesticides to environment and health. Dr. Gomez also from the Department of Biology helped us with this. And we also distributed various IEC materials. Yung paper po natin ay nakapublish sa BSU Journal. So, available po doon yung kabuuan ng aming write-up. And then, we also went to the community to present the results, validate also the results. And then, we also started disseminating the results of our study through public forum. It's a taboo, it's a very familiar event. So, hindi siya masyadong pinag-uusapan, kaya minsan hindi rin siya na-address. It's filled with cultural meanings and understood within its social context. So, we cannot really compare a suicide case or suicide cases in the urban area with suicide cases in the rural area and say the factors are the same. So, titingnan natin ano ba kasi yung socio-cultural context din ng community. Accessibility and availability of means of suicide can facilitate self-inflicted injuries, and therefore is one of the major things that we have to address. The impact of family history, suicide cluster, and peer pressure can be very serious. Accessibility and availability. Okay. The controlling character of technology, in this case, pesticide, has been indicated. And farmers are replete with practices and beliefs on pesticide use and safety that put them at risk. These are also the lessons that we have learned in the conduct of the study and also in the conduct of the extension activities. Suicide is a complex and sensitive issue, and therefore it's important that respect and adherence to an agreed ethical guideline be built between and among stakeholders, or established to build trust among stakeholders. Yung survivors and bereaved families have special needs, and their involvement in the study and the extension activities, whether as participants or as advocates, must be handled carefully. This is one of the limitations that we experience, no? Kasi hindi naman kami mga licensed guidance counselors or therapists. That's why we had to ask the help of Dr. Sipayan to establish activities that can where the members of the community can socialize with each other and therefore provide venue for social integration. Comprehensive plan for the assessment of health and well-being situation of farmers and restricted access to highly lethal methods. So, yung restricted access to highly lethal methods such as pesticides may include doing this, inventory of banned pesticides and coming up with appropriate actions for violations. Also a review of policies on chemical use, distribution and disposition, and integrate relevant policy changes, including appropriate education of farmers and other stakeholders. Tapos, implementation of education on all fronts, on pesticide handling, on suicide detection and early warning signs, and alternative technologies and practices, especially for our farmers, and implementation of liquor bans and curfew hours. So, yun po, yung kabuuan ng aming extension and research parts of Project Pansinan. Thank you very much.
Once in their life, okay, there is a transient thought, meaning napag-isipan na nila. Okay, at least once. Okay, once in 6 months. Okay, napag-isipan na nila. In the past 6 months, naisip na nila, magpapakamatay na lang ako. Okay, once. Okay, which occurred in many. But of course, a lot of us are still alive today, meaning that one thought, okay, did not lead to the negative side of the force. Okay? It led to a healthy fear of death. Okay? So meaning may mga interventions. What are these interventions? Okay? I think that there are protective factors, not actually suicide yet. That's why my topic is more on the prevention side of actually before leading or before going to becoming a person suicidal. Okay? My study is on Benguet State University college level students. I wanted to study college students in the Cordillera. Okay? Pero sabi ko, I think BSU student populace is a representative already of the college students in the Cordillera. So I chose Benguet State University as my a place for me to conduct my study. Again, my study is on suicidal ideation, not suicide. I'd like you to be clear about that. What is suicidal ideation? Okay, suicidal ideation. These are self-reported thoughts of engaging in suicidal behavior. Okay, meaning. If you can recall, if you were once, if you can probably, for some of us, okay, for some of us, if you can recall, healthy fear of death, okay, meaning, yes, you might have thought of, you have transient thoughts of killing yourself, but it will, if you can see that there are protective, you can see that your family loves you, that suicide is not the solution to all your problems, you will realize, you will reflect that life is important, and therefore you will realize that you will have a healthy fear of death. You fear death in a healthy way, meaning you do not like, in the end, you do not like to kill yourself because you know that there is more to life than killing yourself. Okay? If a suicidal ideation, if an ideation is not intervened, okay, it's not prevented, meaning nag-go on siya, okay, it may lead to serious contemplation. Okay? That's when they start. I think I have confirmed that it is better that I will not be around in this world anymore. Okay? And then from suicide contemplation, it will lead to planning. Okay? On this day, on this hour, what method, where, how, with notes. Okay? Those are planning. And then from planning, andun na yung attempt. Pag nag-attempt, pag namatay, usually lalaki. First attempt kasi lalaki ang namamatay. Kasi mas lethal yung mga pinaplano nila. Pero nag-attempt, buhay, malamang babae. That's why if you will notice, in many studies, there are more reported cases for females attempting suicide, but there are more suicide cases for males. Okay? Ang difference nila yung lethality. Mas big shot ang mga lalaki kung magplano. Okay? Talagang tigo. Okay? Walang kawala. But for females, usually yun ang nangyayari. Okay? But that's the negative side of the force. Okay? Okay? So I thought of that. Suicidal ideation is too wrong. Now, if I am able to determine what predictors will lead to the wrong side of the force, okay, I think I will be able to make contributions in order to prevent this one. That's why I continued with my study. I studied 9 factors, okay, 9 factors that will have that predict suicidal ideation. But I came up with, after conducting my research, I only came up with, I was only able to identify 5 important factors that tell us something about suicidal ideation. Okay? But first, kasi nga, predictors and severity of suicidal ideation, uunahin ko nang sabihin yung result ng severity of suicidal ideation bago yung predictors dahil mas mababang usapan natin yun. Okay? What have I found out? Okay? Among BSU college students, I'm happy to report that. Okay? We have a very low, actually, if there are more words to describe, it's a very, 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 very low collectively level of suicidal ideation. Of the 600 students, sample size, 600 students that were screened, okay, I have found that we have a very low level of suicidal ideation.
The levels
Okay?
of suicidal ideation
Of one tribe to another. Please, huwag niyo akong husgahan, result lang ito, okay? Of a certain situation to another, okay? And I found out that okay? If you are a local migrant student, okay, I found out that there is a higher level of suicidal ideation. Okay, but aside from the 4 ethnicities presented in front, I also studied a lot. Okay, there were about 15, I think, 15. Pero hindi na representative sample yung iba. So pinili ko lang yung 4 at kinompare ko yung 4. At nakita ko nga na among our Tagalog students, okay, those who consider themselves not Igorots, okay, but instead Tagalogs, they have a higher level of suicidal ideation. Okay? And we're happy that our Kankanai students have the least level of suicidal ideation. Okay? Very, silang least, okay? Very minimal, kumbaga, compared to Tagalog. So what I have learned is that if there is more adjustment issues ata talaga if you are a migrant student. Okay? Kasi syempre, malayo ka sa family mo. Malayo ka sa iyong protective factor. Ang hirap makisalamuha dahil lahat sila nagkakankanay, nagsisiman-siman ikaw ano yun? Okay? I-express mo sarili mo, it's either hindi ka nila maintindihan o hindi mo sila maintindihan. Okay? So I think ito yun. Okay? Kaya siguro ganito yun. Okay? Pero remember, hindi lahat ng Tagalog student nagpapakamatay. No. Okay? Kahit mataas ang, i-compare ko yung suicidal ideation nila against the other 3, it doesn't mean, okay, that they are more prone to suicide. No, not like that. Okay? It's part of my recommendations about studying the protective factors. Okay? Aside from ethnic affiliation, I've also found that, okay, for students whose parents are already separated, okay, not yet separating but already separated, they have a higher level of suicidal ideation. Again, students whose parents are married and whose parents or whose mother or father is the only one living. Okay? Okay? So it will really tell us that one of the protective factors ng family, okay, close family ties, it's a protective factor. Pero kung nag-away-away, ang nanay at tatay mo, kung lagi silang nag-away o kung nag-separate sila, it is a cause for a student to think about killing themselves. Meaning, they take it upon themselves, problemahin yung problema ng magulang nila. Okay? Hindi may iwasan. I have a very good recommendation for you to your parents later on. Okay? So what have I found out? Males and other things that I have found out, supposedly dapat mas mataas ang females. Okay? Hindi, I mean, not supposedly. Expectedly, in research, usually mas mataas ang suicidal ideation ng females kaysa sa males. But for BSc college students, they're the same, relatively the same. Okay, they're relatively the same. I think that kasi most of my respondents are kankanaay students, kankanaay, tapos female, okay? I think my child rearing practices has an effect, okay? They are raised to be equals with males, okay? They are raised to be equals with males. So I think that it's the reason kung bakit pantay, okay? Students from farming locales have the same level of suicidal ideation from students who come from non-farming locales, rural versus urban. Okay? So, somehow, kung titignan mo yung data ng suicide, it will go against, hindi naman it will go against, pero I think that in our farming locales, kung ang reason nila ay, kung ang method nila is pag-inom ng pesticide, more or less it's the same level with students who grew up in the city but on a different method. Okay? So in terms of suicidal ideation, the same. Okay? And I've also found out that students with an atypical family structure, meaning either they are living with the mother only or father only, or they are living with their grandparents, or they are living with their siblings, okay? A typical family setup, they have the same levels of suicidal ideation with students who are currently living with a typical family setup. Okay? Those things. Now, conclusions. BSU college students have thoughts of suicide that occur at least once in relation to the different factors presented. Okay? Psychological factors include personality, and social factors include family-related and non-family-related factors. I would also conclude that migrant learners, those who are not natives of the area, and students whose parents are separated have a higher level of suicidal ideation. And the gender, place of origin, and family setup that seem to affect the levels of suicidal ideation among college students. Okay? What are my recommendations? Immediate recommendations. First, school administrators, I would recommend to introduce, if not, strengthen school programs such as student organizations, support groups, guidance, counseling, okay, not only guidance and counseling, but guidance, counseling, because some, I think, like in high schools, in some schools, wala pang registered guidance counselors, so there are still parang designated teachers who can give guidance, not counseling, okay? So please strengthen those programs, okay? How do you strengthen those teacher designates if they are not registered guidance counselors? Increase the number of trained and licensed helping professionals like guidance counselors, and promote teacher guidance counselor administrator relationships. Okay? I'd like to point out the importance of teachers in referrals. Okay? Kayo po ang nakikisalamuha everyday sa mga estudyante natin. As guidance counselors, as much as we would want to, pero hindi kami everyday na nakikisalamuha sa kanila. Ang ratio namin ngayon is 1:2,000. We just cannot simply face 2,000 students every day. Okay? So teachers, we'd like that you help us identify these students. If you see a student na kilala sa classroom with a depressive personality, at nalaman mong recently nakipag-break up sa boyfriend niya, at parang noon, alam mo, ang parents nito hindi siya pinapansin.
I'll just give you an overview para ma-correlate nyo yung importance kung bakit ko kinuha yung profile ng mountain trail para ma-compare natin sa international, national, and local. So, in Asia, known naman na Japan ang number 1. Ang isa rin na highest is Sri Lanka. Ano ang sa mga countries na ito, ano ang common method na ina-employ nila when they commit suicide? it's pesticide poisoning. So if you want to verify these rates, you can log on to the WHO. There are reports. So ito yung basically pinapakita ko lang. Okay, so in the Philippines, ito ang nasa database ng WHO. Sabi niya, 2.5 per 100,000 population ang rate for men, and then 1.7 per 100,000 for women. Ang baba, di ba? Comparing sa international na highest na rate. So, mababa. Kaya lang, take note na yung data na yan is from 1960 to 1993. And nakalagay din doon na in some way, hindi siya accurate kasi nagkakaproblema nga sila sa mga ibang bansa na walang database. Unang-una, walang database ng suicide. Second, hindi sila nagsasubmit ng report nila. So, ito lang, ang basis lang nila dyan is kung ano lang yung nabigay. And then, kung na-update man or hindi, that's their problem. So, yan yung nakalagay sa WHO. Pero ang totoo, di ba, is alam naman natin na marami nang nangyayaring suicide sa ating sa small communities. Not only, I don't think na dito lang sa Benguet. Even in the even sa mga provinces ng Cordillera. I for one from the mountain province, marami na akong na-witness na cases. Kaya lang, we are silent about it. And worse, hindi natin nire-record. And then, yan yung WHO profile ng Philippines. Pero ano to? Kasi merong study na kinandak sa Palawan by a foreigner, by a French anthropologist. At ang kiniklaim niya is ang rate sa Palawan alone is 173 per 100,000 population. Diba? That's recent. Noong 2009. 2006. So, that means ito, hindi pa siya kasali doon. So, tingnan natin. Now we go on to ano yung purpose ko kung bakit ko ginawa itong study na to. Generally, gusto ko lang magkaroon ng profile. Kasi kahit pumunta kayo sa DOH, wala tayong database for suicide. Pumunta sa mga pinuntahan kong mga munisipyo, wala talaga silang, alam mo yung formal or what they call that, recording on our cases of suicide. Parang nag-bank lang ako sa mga certificates, death certificates, sa mga interviews sa mga doctors, sa mga interviews sa community. So, doon ko nag-gather yung data na to. So, gusto ko lang bigyan ng profile kung ano yung situation ng suicide sa aking mga tatlong subject areas. And then, ang importance ng study ko is, yun nga, nasabi ko na, pag nagkaroon kasi tayo ng database na concrete or supported by evidence, na ito talaga yung number na nag-offer sa different municipalities, then maybe from that, magkakaroon ng move from the community. First, i-acknowledge nila na talagang there is a problem. Second, so, ulitin ko lang po, ang focus lang ng aking study is from 1999 to 2009. And then, it's only sa tatlong municipalities. So, it's more of a descriptive type lang po. So, hindi ko po, ang sasagutin ko dito ay ilan, hindi po yung how and why. So, ito po yung subject. Pasensya na po, pero for the purpose of discussion and presentation of the paper, I really have to mention the names of the municipalities, especially when we go in detail sa mga barangays, occurrence per barangay. Ganun po kadetalyado. So, ang subject ko po dito, ang areas ko po is Kibungan, Bugyas, and Ato. What is their common denominator? They are farming communities. So, ano ang ginawa ko po para, hindi naman basta-basta pupunta ka lang doon at pwede kang mag-gather. So, first is, kumuha po muna ako ng approval and endorsement from the Department of Health. Magkabotahe was the director that time. And then, I was endorsed to Dr. Piok. And then, from the endorsement of Dr. Piok, I was able to coordinate with the different municipalities. And including kasali na po doon si Dr. Alumnes. Okay, so after that, ang ginamit ko po is yung standard, meron kasing standard na questionnaire ang WHO. So yun yung pinalo ko na in-administer ko sa mga relatives ng mga namatay. So, ang ginawa ko po is, first, nag-call out po ako sa mga records ng hospitals, kung ano yung mga na-record nila na suicide cases. And then, I went to the municipal offices for, nag-review ako dun sa mga death certificates, kung ano yung, nandun naman kasi nalalagay kung ano yung cause of death. So from that, dun po, yan ano. Tapos, after that, pumunta pa ako ng barangay level. So, pumunta ako sa isa na na-identify na family na may relatives na nag-commit ng suicide. And then from that family, sasabihin, meron pa sa kabila. So, pupunta ulit ako sa kabila. So, ganun ko po kinuha itong data na ito, lahat na ipapresent ko. So, hindi lang po sa isang paraan. Marami pong paraan. And I did interviews sa mga doctors sa hospital level naman. So, hindi lang po mere na tinignan ko yung records, I also have to validate them. Sa death certificates kasi may mga iba na hindi klaro. Kasi daw, ang sabi ng mga ibang doctors is, kung minsan daw kasi aawayin sila ng pamilya nung nag-commit ng suicide. Kasi bakit daw yun ang ilalagay na cause of death sa kanilang death certificate. Kaya mapipilitan sila, hindi yun ang ilagay. Pero pag nakita mo kasi yung death certificate, magkakaroon ka na ng idea na something na hindi talaga ganun yung kinamatay ng nakalagay doon. And pag i-validate mo, pupunta ka sa barangay or sa relative mismo nung namatay, sasabihin niya din kung ano talaga yung nangyari. So, in-include pa rin namin yun sa number ng cases. Okay, so after that, through statistical method, we had the averages percentage. And then, sa suicide rate, how did we come up with the rate? Ito ko yung standard kasi ito na pina-follow sa medical field on how you compute the rate. So, pwede mong i-determine kung ano yung death rate, specific death rate, and then sex-specific death rate. So, ito, kung mapapansin nyo, yung actual number of cases, i-connect natin sa number of the population sa isang community para makuha natin yung rate. So, ano ang nakita ko sa aking study? First, sa socio-demographic characteristics, kung ano ba yung age nila, kung married ba sila, ano yung work nila, yun yung makinonsider ko. So, first, mas marami talagang male. A total of 48, 75% of the total number of the cases that were recorded are male. And then to be exact, 23 of them have been farming for almost 15 years. And then as to their affiliation, of course, sa result, mas marami talagang kankana. Kasi nga, if gleaning from the population, 2,000 population, the census on last 2,000, mas marami talagang kankanae. So it follows rin naman na mas marami ang kankanae na nagkukumit. Pero it will not conclude na ang kankanae are the ones na risk of committing suicide. No. And then, as to their religious affiliation, ano ang lumabas? 48.44 are Catholic, and then 32.81% are Protestant. Pero kung aanohin nyo kasi, from the interviews that we have conducted, some claim to be Catholic kasi doon daw sila na-baptize. Kaya sila naging Catholic. Pero as to if they are going to church or doon ba talaga sila nagsisimba, hindi daw. Pero clinically nila na Catholic sila since doon sila daw nagpabaptize. So yun yung rationale kung bakit ang lumabas is mas mataas yung mga Ang religious affiliation is Catholic. And then, ito na. So, we have recorded a total of 64. Kung titignan nyo siguro, maliit lang yan for the three municipalities. Pero, huwag natin kalimutan na yung 64 na yan, i-relate natin sa population ng isang community. So, in Atok, we have a total of 9 from 1999 to 2009. Klaruhin ko lang po as far as the documents and the interviews that we have conducted, ito po yung naging figures na lumabas. And then in Bugyas, we have a total of 28. In Makayan, no, that should be in Kibungan, a total of 27. So, giving us a total number of 64. Sorry, that should be Kibungan. So, ipa-plot natin. So, ganyan yung nagiging so, you could see a peak year 2002 and 2009. So, if we go per barangay, ito na siya. So, para makita natin. So, just to show you. Pero hindi ko na iisa-isahin. Ayan. Kung paano tayo nag-arrive doon sa total. Okay. So, using yung rate na yung formula na binigay ko kanina, na piniset ko kanina, ito na yung nagiging result. Sa Kibungan, 20.08 per 100,000 population. For Bugyas, 9.52 per 100,000 population. And then 5.57 for Atok per 100,000 population, a total of 35.17. So nakita niyo kung paano yung raw data kanina, ano yung impact niya pag nirelate natin sa population ng isang community. So what does that imply? Yun. It exceeds the annual mortality rate of 14.5 per 100 population. Mas mataas pa sa international rate na na-identify. And then, yun nga, first, second, and third, yung pinakita ko kanina. So, yan siya. And then, next is, how about pag i-ano natin yung rate nila as to their, whether they are males or females. Is it because, so ito, male na accessible sa kanila? Di ba kailangan nyo na muna ginagamit nila? Pero sabi ko nga sa inyo, ang limitation ng study ko is, I will only show you how many, hindi po how and why. And then, specifically, yung nag-commit ng suicide through self-poisoning by pesticide, 44 of them used Tamaron. And then, 14 followed by Gramoxone. Ito kasing Tamaron, mas matagal pa ata ito kaysa sa Gramoxone, ang alam ko. Noon pa. Kaya ganyan karami. Pero ito kasing 14, nag-peak siya ng 2009. Na halos lahat ng nag-commit ng suicide doon, ang ginamit nila is pesticide poisoning through the use of Gramoxone. Siguro Dr. Alones would share kung ano ng Gramoxone, kung bakit yun ang gusto nilang ginagamit. And then, we also tried to find out kung saan ba karaniwang place sila nagko-commit ng suicide. Ang lumabas, mismo sa tahanan nila. Pero kung titignan kasi natin, di ba sa farming communities, ito yung bahay mo, dito na rin yung farm mo. So parang, kaya siguro ganyan na ang lumabas is, karamihan is house, kasi karamihan din near their farms. Or if not, napansin din namin kasi na yung house nila may adjoining lang na maliit na parang small bodega. storage na kung saan, kung papasukin mo yun, ang nakalagay din yung mga farming materials, yung mga ginagamit nila pang farm. So, adjoining lang ng bahay. Kaya siguro, I'm not concluding, pero as to yung pre-represent lang is, mataas ang rate ng suicide sa farming communities. Ang gamit nila is pesticide poisoning. And then, identified pa yung mga ginagamit nila. And then, yung place nila is, place of commission is sa house or sa home. Sa farm, 16 also, sa farm or garden. Ito na siguro yung mga, malalayo yung bahay nila sa garden area. And then sa others, itong others na ito, yung iba kasi ginawa daw sa bahay ng friend, sa inuay, sa small bar, yung mga ganyan, near the river, mga ganyan yung mga others na ito. So, this proves that the findings of the WHO that in developing countries, pesticide ingestion is one of the leading suicide method. And then, yun nga, maybe it's because of the easy accessibility of this farm. And then, so what are the conclusions that we have derived from the findings? First, suicide is predominant to Kibungan, specifically to that barangay, as the highest recorded suicide cases. Bugyat and Atok has recorded data, however, the cases were distributed to its adjacent barangays. Ang nangyari kasi kung bakit ganyan yung result, pag i-clean natin yung tabulation, sa Bugyat and Atok, sa lahat ng years, parang pare-parehas na meron. Unlike in the case of Kibungan, na this year meron, next year meron, and then the succeeding years biglang sa taas. Hindi natin yung ma-establish sa Bugyas and Atok. Pero, sa kanila rin naman, pare-parehas na sa lahat ng years, meron at meron nagkukumit ng suicide.
Wag mo gagawin. Okay, guys? Okay, so now, after a very local situation with Ma'am Gapasi's presentation to the academe itself and the college students with Sir Piama's presentation and the profile of the three party communities, now we go now to the hospital report. However, we already gave you the brochure on the statistical data, no? So your questions will be thrown na lang po on the open forum later on. And for this time, we are very fortunate to have one of our speakers in the paper na tutugon ngayon sa sitwasyon ng local community on biomedical perspective of suicide. We have here the Director of Clinica Alunes in Sinipsip, Bugyas, Benguet. Let's all welcome Dr. Joseph Alunes.
Thank you, sir, for the introduction. Good afternoon, colleagues, our visitors from the provincial government, and of course students of the university, the different agencies who are here this afternoon. I hope you will listen to my short is very short. So. First, I want to thank the organizers of this forum for inviting me. So, I will make my lecture as short as I can be so that you not be, what we call this, information overload.
Okay, so this is looking suicide in a community-based approach. So, what is suicide? So it had much has been said about suicide. I just got this definition from the WHO. So the act of deliberately taking one's life through the use of the following. So they have enumerated this spectrum of resources like firearms, self-inflicted injuries in the lot of it. And then chemicals and community area wherein most of the people are engaged in vegetable farming. Usually the most common risk will be mental disorders or personality disorder. It could range from familiar or not familiar. So personality, of course, depression, according to psychiatrists, the most predisposed patients or people are those people who are depressed. So schizophrenia, and then other diseases. So people who are afflicted for many discerning diseases like cancer, HIV, and other debilitating diseases are at risk of committing suicide. Okay, again, local statistics. And I will just be comparing with the global one. They have said it a while ago, 40, in every 40 seconds, one will commit suicide, successful suicide. Okay, national, they have presented it a while ago. And local community, we have gathered 5-year period statistics. We have 114. Okay? So look again, those community, the 3 municipalities of Kibungan, Bacon, Bugias. The others will include Mountain Province and Magayan and the adjoining municipalities. Okay? So Kibungan is the highest. Any violent reaction from Kibungan people? Okay, that one part of the pie, still Kibungan is the highest slice of the pie. Okay, according to age group, okay, the same again, 11 to 20 age group is the most predisposed population. Okay, the next one is 21 to 30. So it's almost the same with the data that we have presented a while ago. Same. So 11 to 20 age group is the highest one. Any violent reaction? None. Okay. Categories, we try to categorize the different chemicals that they have utilized in committing suicide, and these are the following. So fungicide, 12. Insecticide is of course 62. Then herbicide, that includes gramoxone. And poisonous herbs, we call them poisonous herbs as bukat or taugtog in the local dialect. And others like chemicals or household cleaning agents. Okay, chemicals used in suicide. So the highest, of course, is insecticide, and that includes organophosphate. Okay, like Tamarol, and Tamarol, Somicidin, and plus what we call this, the pyrethroids. Okay, number of cases per gender again. So 70-30. So again, the dominant gender is complaining. Why? According to the data, there are lots of male who are committing suicide. A summary of cases. The same, I just distributed it, and the different other, they are alive or dead, or they are referred to the different institution in the city. So 97 are or were able to survive, and then 12. So that is according to the biomedical competence of the people in the hospital, so, the clinics. The year of commission. So according to our data for the 5-year period, there are peaks like the year 2008 to 2009, and then again to 2011 to 2012. So what are the reasons? During that period, 2000 or during 2000, 2011, there is a bump of some of the common weedicide that's being used in committing suicide. Then after that again, there are some, I think, what we call this, the means of monitoring the ban was not being carried out properly, so it's going up again. Okay, so what are the interventions, possible interventions on suicide? Of course, number one is education again. You know, few countries do have some prevention or prevention programs on suicide. And so, this is one of the interventions that we want to focus on. Okay? Number two, restriction of access to resources. Number three, psychosocial evaluation and management. Sometimes you do not usually point to what is really the problem of those committing suicide. Okay? And then the last one is address attempt as a call for help. Suicide is supposed to be an SOS or a core, what we call this, a method of, okay, what are the evolving challenges and obstacles? So number one, of course, lack of awareness. So many people, even those people in the medical field, are not fully aware of the severity of the suicide problem in the healthcare system. So we have to be, with all the recommendations that they are presenting a while ago, must be looked into so that we have to be a part of these interventions. Maybe you belong to the health or to the non-health sector. It is our job to be part of the awareness program. Number two, inconsistent gathering of data. It was presented again a while ago that most of our data gathering from the Department of Health must start its own program. So, as I've said, my lecture is short. So I got this from Psalm 34:22. The Lord redeems the soul of His servants, and none of those who trust in Him shall be condemned. Okay, so sometimes we condemn those people who have committed suicide. Sometimes some communities, some religions, some groups will really condemn them for a coward act. But according to this, the Lord can only condemn. The Lord cannot condemn those who really trust in Him. Okay, so say no to suicide. And before I will end my short lecture on this, it is a concern in the community that suicide is not really addressed properly. Okay, so as part of the group, I hope this advocacy of looking at suicide prevention and intervention will not really rely on people who belong to the healthcare system, but as well on the non-healthcare sector. And many of us are here to start the program. Okay, so let everyone see a brighter tomorrow by addressing this advocacy. Thank you very much.
Maraming salamat po, Dr. Alines. At narinig po natin ang mga pahayag ng mga ating mga panauhin hinggil sa isa sa mga problema ng hindi lamang na Pilipinas, kundi pati na rin ng ibang bansa.
Kung nakita nyo mga na-discuss nila kanina, lalaki si Vincent. Lalaki ba si Vincent? Biologically lalaki at gusto niyang gamitin a more lethal way, which is baril. So, kino-corroborate niya yung mga sinabi ng ating mga speakers. Ang mangyayari po sa ating question and answer or sa ating open forum, hopefully we'll have maximum 5 questions per speaker. We'll be conscious about that kasi medyo 30 minutes lang po allotted sa atin. If you have a question, please identify yourself and the group. you represent. At we'll probably start with Ma'am Morsha sa order ng presentation, no? And be brief sa questionnaire and be straight to the point, okay? Who will ask the first question? Let's start with Ma'am Morsha perhaps sa Project Pagsigdan, about the Project Pansigdan. Any questions? You can approach the mic here. Yes, sir.
Maybe Mr. Bagano from the Office of the Governor, and we're glad that we have the two board members here. Maybe we will just make a little revision of your suggestion on how we will proceed with this program. Because from here on, and we would like to express our greatest appreciation to Benguet State University, Dr. Alones, and to all of you for being with us here. Now, I have been listening carefully to the presentation, and we are so glad that some of you are coming up, awakening, and to help also the province of Benguet find some measures on how we can contain this. Well, of course, Dr. Batani knows that because when the suicide cases late in 2009 came about, there was the provincial task force. And can you still remember? Yes. And so, the action of the provincial government of Benguet immediately wrote Gekana for this banning of gramoxone in the province of Benguet. And indeed, that ban was already issued, and so wala yung gramoxone dito. The only problem is, while it is banned in the Cordillera, it is not banned in the other provinces. Kaya lahat ng mga farmers natin, pumunta sa Romeo, sa Nueva Vizcaya, sa Pangasinan, doon sila bumibili. Now again, there is a rise in the number of suicide cases. And we appreciate, because from here on we will start working together, as stated by Dr. Alones, involvement of all sectors. And we are very glad to inform you we will support Benguet State University because there is a provincial ordinance authored by the provincial board members about the disposal of pesticides, and we must have to share this with you so that it will be complementary. This is not a question, but I am relaying the message of the provincial government of Benguet that we are very helpful to this endeavor. So, marami sana akong sasabihin, pero let's give others a chance to. And we will complement each other. We will help. Thank you very much.
Thank you, Mr. Bagano, from the Office of the Provincial Governor of Benguet. Tama po, if you have other questions po, ibibigay naman po ang details ng speakers. We'll provide you the contact details of the speakers so that kung meron pa kayong gustong tanungin, pwede po kayo mag-follow up sa kanila. Any other questions po? Burning questions that otherwise did not ask? Yes, ma'am. Will make you depressed.
I'm Dr. Paskin from ATO. Thank you for the researches which you have presented. And it is true that suicide cases have been increasing in the Mountain Shale area. But I would just like to clarify about the research done by Ma'am Asiwan, because she said that the source of their data was at the municipal health office. However, I am wondering why I was not involved in that. I was never interviewed in that. I was not interviewed during the research, and I'm from the municipal health office. Okay. And then one thing more, I would like to correct. The statements made a while ago that the health sector professionals ignore data on suicide. Okay. So, true, we do not have any database, especially at the Department of Health. But in fairness to the Department of Health, they are also trying to address the problem on suicide. So, they have now this program on adolescent job aid manual. So it caters to the in-school students, wherein students with suicidal tendencies are being catered to. However, it's unfortunate that Benguet is not still a target. They still target the other provinces of CAR, but not Benguet. So, what we would like to ask during the next, kung meron man tayong gagawin, let us work together to address the problem of suicide. And I hope that in the future you would really involve us from the municipal health office as being the frontliners in health.
Thank you po, Doktora. So that question is for Pete.
In the case of Atok kasi, first, ang pinuntahan namin is the municipal mayor. And then the municipal mayor directed us to the sa records. So first, doon kami kumuha doon sa mga death certificates. And then after that, pumunta kami sa Atok District Hospital. And then sabi ng Atok kasi, kung ano man yung data dito, yun din lang yung makukuha nyo sa barangay level. Kasi pinupunta naman lahat dito. Or kung hindi dito sa Atok, doon kay sa BGH, sa Benguet or sa clinic ni Dr. Alones. I'm sorry if you were not involved during that time, pero ang inuna po namin kasi is from kung saan kami ide-direct ng municipal mayor. Pero for others, directly naman na inano kami sa mga municipal health sa MHO officer nila.
That's okay. Pero gusto ko lang palang ma-clarify na yung sinasabi ng death certificates, hindi nilalagay ang poisoning or suicide as cause of death. Sa Atok, hindi sa amin yun. We really put the real cause of death na suicide.
Yung statement ko na yun, hindi ko naman sinabing sa lahat po. For some other cases, like in Bugyas. Specifically Bugyas po yun, yung mga cases na gano'n. And former doctor of the Lutheran, yung pinagalingan ng statement na gano'n.
Okay, so I would like to add also on that statement about the Department of Health database. It's an international statement that there is such a notion, or not only in the local Department of Health, but in other areas wherein prevention programs are not really addressed because of poor advocacy and data retrieval. So I've just quoted that in an international paper. So if there are areas that have a good collection of data, then hindi po namin nilalahap. I hope the province of Benguet, and specifically Atok Municipal Health Office, is doing a good recording system. If that is, then congratulations, Dr. Ramaski.
Thank you. Sige po, kayo muna tapos si Dr.
Afternoon to our resource speakers. We would like to commend the efforts of the SU Force for specifically si Mamu, who is also a member of the CRHRDC. I'm Nancy Bandok from the USTCAR, and this forum is really very informative. There are already informations gathered, and that's really a very good start for us to come up with the databases which we are looking for. There were also some gaps that were identified by the presentations, and there are also recommendations for those gaps to be closed. But as it is, I think I'm at a loss and I don't know whom to address this concern that I have in mind. From here, we can see that education, the part of the stakeholders, is really very important to increase the level of awareness of all concerned, of all of us, all of us, in terms of societal tendencies or societal deviation, and that is preserving life. That's our common goal. So from those data, who should be planning, who should be coming up with plans or strategies in order to address this suicide as an ill in the society? If it's for new age na sinasabi natin na sila ang may mandate dito, I hope this is a wake-up call, and I know that Ma'am Doctor from ATO is already here. So in their planning sessions, maybe at the municipal and then provincial, regional level, this should be taken carefully by the important agency who is really mandated to take care of this concern. On the part of the other stakeholders, let's say PSU, they have already started doing the education campaign. Maybe UST, specifically the CRO hopes that in the next days that will come, planning in terms of this problem should be a concern of all the stakeholders. Yun lang po. It's just a rejoinder of all the recommendations.
Okay, that's Dr. Banco from BLST CAR. Would anyone like to comment? Who is the lead agency daw po?
Maybe just to partially answer the query. Lahat naman ng agencies, may mandato tayo to cater to our clients. So perhaps in our own agency, in our own organization, we now start to come up with a plan for interventions or a suicide prevention plan, which would really help our client. But in coming up with the plan, we also think about what would be the ways by which we can collaborate with other agencies. So, halimbawa, ang DOH, sino ba ang line agencies or organizations na pwede rin niyang itap ang kanilang expertise doon sa na tumulong doon sa kanilang programa. Or maybe we can throw the query to the provincial government. Also, thank you po.
Betty will be adding some information.
Okay, so I would just like this to put on record, since lahat ng nandito kasi who are speaking are members of the line agencies of the government. Unfortunately kami, as a co-organizer of this, is part of the civil society. So we are an NGO, and I understand also Dr. Yunis is from the private sector. So I also understand yung tinatawag natin na mandate, whose agency has the mandate to actually lead the particular yung ating advocacy. And so this brings us to the point of maybe there is a need for a platform to really do collaboration. This is very important. This forum is a start, but now we see that the private sector, the civil society, and of course the government agencies, even the academe, we are all concerned and we have efforts, but we wanted to consolidate the effort to come up with a synergistic move. And we only can do this if there is how could we, in what space, in whatever, kung may regulatory kwan ba ito, may policy ba that would actually call for us. I've heard there is this such thing as the public-private partnership. How would this be possible? So maybe that would add to the yung ina-explain kanina ni Tom Marsha. Thank you.
Sino po ang
Antidote apparently, but we cannot get that from any poison center in the Philippines. Syngenta Pharma is the prime poster of the product cannot even give us. So what are we going to do? Customize our own antidote. But now, as the brands keep on evolving, that's a challenge for all of us to be vigilant. I will return it again to you, not only us in the health sector, but all multi-sectoral involvement.
Indeed, there is really a need to customize also information education materials for farmers. Totoo yung sinabi ni Sir na may epekto actually yung pag-ban, no? In fact, some farmers are resistant to the ban. May move pa nga sila to lift the ban. Requesting the provincial government to lift the ban. So, doon natin makikita kasi yung attitudes nga ng farmers, no? Doon sa, kailangan kasi nilang malaki ang harvest. So, para malaki ang harvest, talagang gumamit ng chemicals. That's why BSU is also very strong now in its advocacy for organic agriculture, or at least yung good agricultural practices, which is a combination of organic and inorganic farming. Ganun po, yung isa nating intervention para dyan.
Thank you. Go organic tayo. May ilalagay po kayo? From the community. Akala ko.
Magandang hapon sa atin. With all due respect to Ma'am Marcia, I would like to contradict your statement about the farmers. Although I myself, I affirm to that sometimes, or most of the times, we farmers are stupid at our own best. Because we know, for that matter, that such paraquat is very detrimental to health. But then we are forced, because of our problems, we are pushed by situations. We are sending 3 students to college, and we need the money. And here we are catching up of time so that we can get the price. So we take the risk of using that certain paraquat to shorten the time of labor in the farm. But then, regarding the uplifting of the ban, I was confronted yesterday with the leader. I was hoping to see the signatures of our elders, because it's them we respect. Supposed to be, they are the ones to make the decision for our community. But I have never seen any signature from our local leaders or elders, for that matter, not even from the active leaders of the present organization in the community. What I saw was signature of minors, most of the signatures, if not resident in there, are the ones who just immigrants, or the ones who came there for supply, as we call it in our community. So, kung mamarapatin po ninyo, nasasabihin ko na sana po ay huwag ninyong pagbasihan yung allegedly letter to the office of the provincial governor to lift the ban. Please lang po. Try to do proper validation for the letter. The name of the signatory, the first one who wrote as allegedly a farmer operator is not even popular to me myself. Thank you.
Again, good afternoon po sa ating lahat. Ako po si Michelle, DevCap student po, and we are going to set up an exhibit in line with this suicide prevention. And since nagkaroon po kami ng more information, or mas naintindihan po namin yung suicide prevention, gusto po sana namin humingi ng advice on the proper approach kung paano po namin ipapakita o ipipresent yung exhibit namin. Kasi po yung objective namin is inspire people to celebrate life po. Kasi masyado ko kasing broad yung mga recommendations na na-present.
Okay. Thanks, Michelle. Representative ng kabataan. Siyempre, tanungin natin din yung representative ng kabataan dito.
Broad yung recommendation namin, specific yung sa akin strengthen, encourage students to commit for open and frequent communication. Di ba picture ko yung guidance office. But there, I think following this one, we have a crisis management talk to be delivered by one of the guidance counselors in the Office of Student Services. You will be enlightened on what specific ways, okay? What are the things that you need to be wary of? What are the specific ways that you need to do? Those things. Ang fear lang kasi pag suicide, na-mention ni ma'am, in families, yung, ang tawag dito, yung sensationalization, okay? Kaya, as much as possible, I would recommend that you focus on the celebrating life portion. Okay? Kaysa sa preventing suicide portion. Kasi kung preventing suicide portion, baka kasi mas nakaka-stress tignan. Okay? Mas magbibigay ng ideation, mas suggestive siya sa taong at risk. Okay? So, you focus more on celebrating life. So, that will be your theme. Okay? When you take, kasi assignment ko ni Sir Fillmore. Photography class po ni Sir Fillmore. When you take pictures, you put in mind the theme celebrating life. Okay? The things that they can enjoy when they are alive. Like the fulfillment in the reward in having a fulfilling mother-daughter, mother-son relationship, parent-children relationship, of healthy generation, passing on a healthy generation from one generation to another generation. You focus on those things, okay? On positive peer pressure, okay? Ayun, basta yung let's avoid sensationalizing a suicide case, okay? Kasi nga, for someone who is prone, okay, pag na-sensationalize yung case niya, mas magiging prone pa siya. Okay? Mas iisipin niya, wow, attention is given to that person who killed himself. Try din nga. Okay? Parang ganun kasi ang parang mangyayari, ha? Lalo na pag adolescents, they don't have a genuine wish to die. Okay? There is no genuine wish to die. But there is a genuine cry for help. Okay? And that cry for help is presented in a very negative way. Okay? So they are crying for help pero namatay sila. Okay? So don't. Yun lang. With celebrating life and observing the observance of suicide prevention, let's not focus, kaya ako protective factor, let's not focus more on sensationalizing the issue, but more on promoting the celebration of life.
Let's celebrate life, let's enjoy life. Ano yung speak kanina, we'll ask a message from you po bilang pangwakas sa public forum.
Sorry, I just arrived. And this was actually yung heart namin na initially talagang kami
kina Ma'am Betty, Dr. Ryan, upon nag-meet kami na we have this alarming cases of suicide. So I brought to them the data, and then they helped me practice data, and then we plan for this. Thank you very much.
Gusto kasi ni Ma'am Estrel na talagang 1 hour siya i-discuss na talaga yung katotohanan na nangyayari po sa atin. At iiyak pa siya sa harap niya. Kaya po ka-dedicated sa trabaho niya, ka-passionate po sa provincial health office. Ngayon po, nagpapasalamat po tayo sa lahat ng ating mga speakers. Thank you so much. At sa inyo din, sa inyong mga katanungan. No? Let's remember, one suicide is one too many. Especially for us na Cordilleran, which is na tayo ay very loving community po talaga tayo. Our culture values life. Thank you very much again to Phoebe, Pasiwen, si Ms. Estrella Apo, si Dr. Joseph Alunes, si Ma'am Morsha Kapasin, and Sir Ramon Fianga.
Thank you very much, Dr. Ryan. And before you leave po the stage, kahit na walang elevated, no? We will take this opportunity to give our certificate of appreciation. Allow me to read the content of the certificate. But don't worry guys, huwag muna kayong umalis. Meron pa po tayong next part of the presentation. No? Cordillera Regional Health Research and Development Consortium, Institute of Social Research and Development, Office of the Vice President for Research and Extension, Benguet State University, and ResearchMate Incorporated award this certificate of appreciation to for presenting her paper titled during the Regional Suicide Prevention Day Research Forum held on September 10, 2013 at Gladiola Center, Benguet State University. Given this 10th day of September at Benguet State University, signed the Director of ICER, BSU, Ma'am Ruth S. Batani, the Executive Director for ResearchMate Incorporated, Betty C. Lestino, and our Vice President for Research and Extension, Ma'am Luciana Villanueva. Now may I call on Ma'am Ruth Batani and Ma'am Betty Lestino to please award the certificates. First in line, Ma'am Ruth. First in line we have Ma'am Phoebe Pasiwan with the title and presentation, Profile of Suicide in the Mountain Trail Areas. Sir Ramon Fiangaan for the paper titled Predictors and Severity of Suicidal Ideation among BSc College Students.
We will be expanding more of that later. It may also be a form of self-punishment. I know of someone who committed suicide. He learned na yung anak niya may sakit na mahirap gamutin. And then he blamed himself kasi wala siyang magawa. The father committed suicide. So sad. He left the child na walang mag-take care. Okay? And then, it can also be an attempt to be noticed. Gaya nga ho ng sabi, kaya din ho, it's not really advisable na i-sensationalize ang isang suicide case because people who wanted to be noticed are given the idea. Okay? And then, are relieved from hopelessness. Wala nang options, and then hopeless na sila. Like, if their problems would be rooted sa financial or family, walang magagawa. Yun pa rin yung pamilya Walang hope there. And then, it can also be an act of hostility. It was mentioned in the researches earlier. It can be a form of revenge. Okay? It can be a form of revenge towards parents or other authority figures. Okay? Not only, let's not limit it to the parents. Pag naman sa workplace, baka pwede dahil sa boss. Mga ganon. Okay? And then, it is an end to pain. Okay? In many of the papers and sa mga interviews ko dun sa mga suicidal clients, ang ano lang naman nila, ang main purpose nila for wanting to kill themselves is not actually to kill themselves. It's to put an end sa pain na nararamdaman. Yun. So if we can do something to alleviate that pain, we can prevent suicide. Okay? There. And then, now that's our model created by what do you call this? Researchers as well as experts who studied suicide. For the first model, the hopelessness model, when people are faced with high negative stressful conditions and cognitively unable to develop effective problem-solving ability, they will likely lead to suicidal behavior, mainly through its impact on hopelessness. So, pinagsama ko yun. Faced with highly negative stressful conditions, pwede yung break-up, pwede yung nag-separate ang parents, nawalan din, namatayan. That can be a highly negative stressful condition, especially if unexpected yung death ng isang malapit sa taong yon. And then they are cognitively unable to develop effective problem-solving ability. Yun ho, nag-combine siya. There is a predisposing factor, merong aggravating factor na pumasok, yung suicidal thoughts na, yung suicidal ideation, nag-lead na siya into completed suicide. Okay, so doon ho ulit tayo papasok sa ating intervention. Now, for another one, I believe this is closely related with the presentation of Mamorsha, the research, the model that they were able to come up with. This particular model kasi considered the predisposing risks, precipitating, and protective factors. Yeah. Examples, problems with loved ones, everyone has that. Poor problem-solving skills, negative view about life, yun ho yung meron sa tao. And then that created some suicidal thoughts. And then, nadagdagan pa yan ng daily stresses, like nahihirapan sa school, some minor problems perhaps. Nagsushow na siya ng symptoms of hopelessness, negative self-evaluation, suicide, ideation, helplessness, and hostility. Now, it can lead to either low to high level of suicide risk. Pero pagpasok ng precipitating factors like flow in the interpersonal relationship with family, peers, and opposite sex, and then, another example, loss of loved ones or job. Tingnan nyo, may problema na dati sa loved ones, tapos may nawalan ulit. Or kunyari, poor problem-solving skills. Tapos nagkaroon ng daily stresses, naipon niya na naipon, tapos poor ang kanyang problem-solving skills, tapos biglang nagkaroon ng sa kanya major na problem. Or pwede rin sa school, yung biglang binagsak yung kanyang major subject, na yun lang yung paraan para maging engineer siya. Mga tipong gano'n kasi yun yung, what do you call that? The screening subject, para tumuloy-tuloy ka dun sa course mo. That can be a big blow to the individual. Yan. So, it can lead to higher level of suicide risk. Now, papasok po tayo dun sa interventions. Highlighting, pasensyahan nyo na ho, gaya na ho you made mention earlier of paano magtulong-tulong yung mga agencies. Ngayon naman ho, magpo-focus tayo dun sa individual per se. Okay? Now, so counseling or psychotherapy, and then creation of support system. Yung mga minention kanina ni Sir Mo na we have to create religious groups or other support groups. And then, if you will do that, mag-intervention tayo dyan. Pag nandyan na siya sa low to high level of suicide risk, hindi siya magiging eventual suicide, prevented suicide po yan. Okay? So, speaking from this, these are just some samples of factors that may contribute to teen suicide. It can also be true to older adults. Okay? Violence in the home. Absentee parents, most of my clients ho, one of the parents may be abroad, or yung isa, pareho silang nandito sa Pilipinas, yung isa nandito sa, kunwari sabihin natin sa Baguio, yung isa nasa Manila, so yun, absentee parents. Okay? And then, ano po kasing implication yan? Doon ho sa problem-solving skills. Baka ho, nakulangan nung assistance as he was trying to grow up and trying to develop his problem-solving skills. Inability to find success at school. One of my clients na overwhelmed sa dami ng kanyang requirements, pagpasok na ng third year, nag-slash po doon siya ng risk niya, at saka malalim po talaga. Okay? Those things para sa atin, ganun lang, pero hindi ho. Para sa atin kasi malabo, ay mababaw lang. But for others, because of the predisposing factors, hindi nila kinakaya. Okay? And then, feelings of worthlessness, wala na ho akong kwenta. Ganun, rejection by friends or peers. They may be a part of a peer group, pero pag nandun siya sa peer group, feeling niya naiit sa puwera siya. She feels like she's not part of the group. Okay? And then, substance abuse can be one. And then, death of someone close to the teenager. And then, the last one, there's suicide of a friend or someone she knows online or personally. Great degree of social isolation. Gaano ka katagal na nag-iisa lang? Gaano ka katagal na hindi na sumasama sa friends mo? It's been a month. It's been a week. Parang ganon. Sino ka ba before that? How were you before that? For you to see yung sudden changes in behavior niya kahit first time mo siyang makausap. And then, great degree of depression, loneliness, depressed na night. Okay, depressed ka, scale of 1 to 10. How would you rate your depression? 11 ulit. Buti baka 20 sabihin niya, ala times 2. Ay. But those are warning signs. They can really answer you that way. And then, great degree of impulsivity, degree of anger and hostility towards kung kanino man siya nagagalit. And then, intent or determination to die. That is one very important thing we should not miss. Gaano mo ka gustong mamatay? At gaano mo ka-soul gustong isagawa yung plano mo? So that you would know kailan ka din papasok as a helper. Okay? There. And then, overwhelming or humiliating environmental stress. Okay? Anong klaseng pamilya meron siya? I mean, anong family atmosphere meron sila? Meron ba siyang nakukuha konting support? Kasi there might be things, there was time kasi na I was advised to call a family. E nung tinanong ko yung family, hindi naman siya nakakonect sa family niya. I have to look for immediate or other people, significant people sa kanya na pwede kong, pwede tumulong, pwede kong pag-reference sa kanya. Okay? There. And then, to what extent is client able to focus on positive future events? Meron pa ba siyang nakikitang goals? Meron pa ba siyang naiisip na pwede pang gawin? Okay? There. Pag wala po, then, let's manage crisis. Pag masyado kong mataas ang ating assessment, anyway, kahit naman mababa yan, let's still manage the crisis. Suicide crisis management po yung tawag natin. Ito yung immediately ho na pwede natin gawin. But before that, these are the basic tools na kailangan po natin. Unang-una, ang kailangan ho ng mga suicidal nating friends, family, as well as students, clients, are our listening ears. I did not just say their ears. We have lots of ears. We have our ears. Sabi natin eh. We have our 2 ears. But sometimes, hindi siya nakikinig. Pagpasok ng, pagpasok ng ating, siguro friend or ating sa bahay, nakita mong supportive pressure, yun kasi listening ears eh, maririnig mo kahit yung hindi nila sinasabi. Okay, maririnig mo, kasi makikita mo pa lang yung mga signs and symptoms na na-mention earlier. Okay, and then pag nagsimula na yung magkwento, you will really give your full attention. They need your time, your attention. Okay, and then, next one, understanding and
Mapalagip kami padayang yakpi, ibiyag ken nasa graduan, tanang kapong mismo ken ka. Digitoyo Diyos Ama, isuti na patid na damdaman at nakararag mi, may buon itinagang tinapatid nga niya ang rumi nga si Kristo. Amen.
Panatilihin nakalinaw ang ating mga kandila upang sabay-sabay natin kantahin.
Ng balita ng kaligtasan.
yakni sukabang din ay kaengni api ang kusisilaw yang may layamayan all of us manyaman amaku bindisyon at sila kami one more time manyaman